The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Very glad you joined us this morning. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and of course our technical producer, J.D. DeAngelis. This morning in the studio with me is Brad White, a compounding pharmacist and the manager of our new Philadelphia store, and our very special guests, Michelle Amos, registered nurse, Kim Swast, registered nurse, and heart failure coordinator from Mercy Heart Center. Good morning, ladies, and welcome to the show.
Good morning.
February is American Heart Health Month, and this month we are focusing on heart health for both men and women. Heart disease is a leading cause of death in the United States. The good news is that it's also one of the most preventable. Making heart-healthy choices, knowing your family health history and the risk factors for heart disease, and having regular checkups, and working with your physician to manage your health are all integral aspects of saving lives. From this, often your physician you can work with your physician, and they're all integral parts of help saving your life. You know, heart disease can be what we call the silent killer because you don't always recognize symptoms until they become too severe. So today we're going to talk about women and heart disease and heart failure, as well as the link between diabetes and heart disease. So I'd like to remind our listeners today that our broadcast is also available on our podcast, which you can download from any of the app stores on your smartphone. You can also look for Health Matters and the Medicine Center Pharmacy on Facebook. You can post up your questions there if you have any, or you can give us a call today at 330-450-1480, and we can talk to you on the air.
So, Michelle, Kim, welcome to the show again. Can you both tell us a little bit about yourselves? Background, education.
Well, I'm Michelle Amos, and I've been with Mercy for close to 20 years now. I work in our heart center, and I review cases that come in through, basically our MI cases, our heart attack cases. Review cases and kind of just work on system processes and continuous improvement so we can have better patient outcomes. I'm married, and I have a teenage daughter and 2 young boys.
Okay.
I graduated from Kent State University in 1996 with my bachelor's degree. I've spent all but 10 months of my career at Mercy Medical Center and 13 years with the Heart Center there at Mercy.
Must like it there, both of you.
It's a wonderful place to work.
Okay.
I've also spent a couple years as a clinical nursing instructor for Akron University while also working at Mercy. My current role as heart failure coordinator, I've been in almost 2 years, and I'm working on my heart failure certification.
Okay, currently. Super. So today we're here to talk about women and the heart disease, as well as diabetes and heart disease. So let's start with some statistics. Is heart disease prevalent in the United States? How prevalent is it for women?
Very prevalent. Actually, about 92 million U.S. adults are afflicted by cardiovascular disease in some form. It is projected by the year 2030 that 43% of the U.S. population will have some form of cardiovascular disease. It's a leading cause of death for both men and women. 23% of all deaths are cardiovascular related.
So we're not getting any better, are we?
We're not.
Why is that?
We're not. And for women specifically, half of all African American women and 34% of all Caucasian women have cardiovascular disease. 1 in 3 female deaths are caused by cardiovascular disease, and fewer women than men survive their first heart attack.
We should be getting better. Why aren't we getting better? With all the technology and the skills and things that we have, why aren't we getting better?
Specifically for women, the physicians don't focus on prevention for women. There's not funding for preventative measures for women, and only 24% of women are involved in health studies related to cardiovascular disease. It's still typically a male-focused disease, even in this day.
Why wouldn't it be equal? I don't get it. I mean, look at the technology we have. Look at the physicians. Look at the skills we have.
We need more women to participate in the studies because there's not enough research being done to help women. And only 50% of women are actually aware of the symptoms and get treatment right away.
Interesting.
So it's still thought of as a man's disease.
It is.
You know, you think of men dying of heart attacks more often than you think of women, because you think of women dying of different cancers and things, and generally it's still thought of.
Well, is it more women affected by heart disease or not?
It is. More women than men die annually of heart disease. Women are 15% more likely to die from a heart attack and twice as likely to have another heart attack within 6 years following their first than men.
You know what? I've never known a woman that had heart disease. I guess, a ton of men out there, that I know of, that from all the, acquaintances that I have that have had heart issues, but I've never heard of a woman that had one. Is that? But yet you say there's more women. How can
Correct,
it be?
because it's not diagnosed. When their symptoms aren't as typical. So a man has the crushing, left-sided chest pain. Women tend to think they have the flu. They become weak, tired, fatigued. They go to the doctor. They do a thyroid workup or other workup, but they fail to look into the cardiovascular.
For our listeners, what's the difference that men feel compared to women, or women?
Men feel the typical left-sided chest pain, crushing in nature, radiates up into the jaw, down the left arm. The typical nausea, sweating. They know. Most men know. They have that impending doom. They know they're having a heart attack. Women have more vague symptoms, and they ignore them. They think they're just run down, they're overworked, they're running around, they're tired. They try to rest, they try to take some Advil, aspirin, relax.
Any chance that, like most of us, that we all think we're invincible? Do you suppose that some of the problem could be that maybe they feel like you just said, I'll take an aspirin or a Tylenol and I'll be okay, and not go to the doctor to get checked out? Is that part of it, maybe?
Time.
Yeah.
They're too busy taking care of everybody else, and they fail to take care of themselves.
So it's safe to say, then, that more women die from heart attack than men?
Yes.
Yeah.
Another thing that goes along with that is if they are having a heart attack and their symptoms are not the crushing, classic symptoms, and they're ignoring their symptoms, say they present like the flu. So they're having this heart attack, and they're going to the hospital a lot later than men typically are.
And more damage by the time you get
the
there.
damage is progressing, and
that's why they tend to
their
die.
outcomes are worse.
I see. Huh.
Okay, so one more time, symptoms, because I just had an experience about 2 weeks ago where I was at a rather high-profile retail store, and I was beside a man who was going into cardiac arrest, and the store handled it very well and got EMS there in time, and it was great. But if the woman was sitting next to me and having some of the symptoms you just described, I'd never know. So in the effort of maybe helping someone who is in denial, one more time for the listeners so that we can make sure that we maybe keep an eye on our loved ones, if you will, or remind them of what's important.
Symptoms for a woman?
Symptoms for a woman, yeah.
Like I said, they're vague. So that's why they don't rush to the emergency room. But they tend to get the fatigue, the nausea, the weakness. They might have pain, but sometimes it's on the right side. I've heard before, if you have pain from your abdomen to your shoulders, go get checked out. It's better to be safe than sorry. It's better to walk out of the emergency room knowing that there's nothing wrong than dying at home of a heart attack.
It's fascinating how different it is. I guess it's just, I don't know. I think in medicine or in some disciplines we expect there to be, this is what happens, this is why, but it's just not always that way.
Right.
So what's a silent heart attack? And are women more likely to have them?
Traditionally, we see, your typical chest pain and the jaw pain with a heart attack. But for around 20 to 30% of people, they have no recognizable symptoms, like we talked about. Usually a heart attack is, found by your family physician by an EKG. But the scary thing about the silent heart attack is that, again, the damage is being done. You don't go to the hospital. You don't even know you had it until you go to the doctor, and the doctor says, hey, look, this looks kind of strange. It looks like you've had a heart attack. Studies have shown that people that do have silent heart attacks are typically have their chances are tripled after that. After having one silent heart attack, their chances are tripled of having another heart attack. And it's not really, I read both places. I read Cleveland Clinic said that it was more prevalent in women than men. I looked at Harvard studies, and it said that it was equal. So I think it's kind of, depending on where you read, but most of the places said that it was equal between men and women.
So how about heart risk factors for women? Are they different from men?
Well, there are some diseases like lupus, rheumatoid arthritis that are more unique for women than men, that pose a higher risk for women for developing heart disease. The lupus, you have like systemic all-over inflammation, so you can have it in with rheumatoid also. You can have it in your joints, but you can also have it in your organs, and you can have it in your heart. So if you have constant inflammation in your heart, the irritation can cause scarring and lead to heart failure.
So you bring up lupus. Is it common in women?
It is more common in women than men.
But is it common? I never thought it was very common.
I don't necessarily think it's common, but we see it more often in our ladies than our men. Same thing with rheumatoid arthritis.
Okay. So what are some heart disease risk factors that women cannot control?
Well, we can't control our age. Well, just like men. I mean, I guess they're pretty much the same.
Can't control being a woman.
Yeah, you can't control being a woman. You can't control our age.
Some people are doing that.
It still makes you
That's a different
risk.
subject, right?
No matter what you do about it, you're a woman.
You can't control your heredity, your family history. The things you can control, just like men, would be your diet, your exercise, some of the disease processes like diabetes. Control your blood sugar better. The better control you're going to have over your heart disease.
Smoking.
Yeah. Isn't the smoking issue bigger with women than men? A la heart disease or not?
It puts you at the same risk.
Oral contraceptives, things along that line.
If you are a smoker and a female smoker, you can have a heart attack about 19 years earlier. Okay. That's how much damage smoking does to you.
Interesting. Okay, we have about a minute to go before the break. Let's do it, huh? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buys store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are joined today by registered nurses Michelle Amos and Kim Swast, who is also the heart failure coordinator at Mercy Heart Center. Have a question, give us a call at 330-450-1480 or post the question on our live Facebook feed.
Okay, before the break, you mentioned some risk factors that basically men and women can't control. How about touching on some risk factors we can control?
Well, the risk factors we can control would be quit smoking, and don't start if you haven't. Modify your diet, low fat, low cholesterol, low salt. Exercise, try to get exercise in each day. If you're prescribed medications, you should take them as you're supposed to. And get your follow-ups with your physician.
2 comments, if you don't mind. On the medication thing, we've come into an age where medications continue to get more expensive, but we find some situations in the pharmacy where sometimes people don't understand that there's alternatives for what they're taking that might be more cost-effective. Mm-hmm. So if you are a person who is in a position where you're struggling to pay for the medication you need, and especially if it's heart-related or really any medication, because your doctor's not going to give you something if it's not important, at least in their eyes, for your health, make sure you talk to your pharmacist or your doctor. We can probably help you find a solution that's cost-effective, and it isn't going to put you at risk. So don't be afraid to ask those questions. And just as another side note for risk factors you can control, maybe you need to look at your priorities, too. I was listening to an interesting article yesterday, transitioning between pharmacies, and the gentleman was talking about it depends on how you run your life, but, take care of yourself first before you worry about taking care of your family, taking care of your work, taking care of whatever you like to do, because it's your ticker that matters the most, and then you can't do anything else unless you take care of yourself. Mm-hmm. So I thought it was interesting. We all are like, I got a to-do list with 97 things to do, and probably exercising isn't on the top of that list, or eating healthy isn't either, so start thinking about those things first.
Okay. We're saying, I think, that women have softer symptoms if they're having a heart attack.
More vague.
More vague. Are they more difficult to diagnose?
Yes.
Like on a regular office visit, okay. Women typically will go to a gynecologist, maybe a general practitioner or internal medicine or whatever. So between those 2 doctors, without special testing or whatever, can they pick it up? Listen to their chest?
No.
Checking her blood pressure, pulse?
No, and if a woman goes in just saying she's tired and nauseous, things like that, they're going to look into, like I said, thyroid, do some lab work, do an EKG. If it's not a heart attack, it might not be detectable. Just doing some routine blood work, things like that. You would need to have like a stress test done.
But we can't pick it up with an EKG?
Not unless you're having a heart attack.
At the time. Mm-hmm. Okay.
Or they can pick up a past heart attack sometimes on an EKG,
Correct.
but
if
not
there's
always.
Done.
Okay.
But if it's just cardiovascular disease, it's not going to really show anything. You need to have like a further in-depth workup, which, like I said, isn't usually the first thing a physician thinks of in a woman, especially at a younger age.
And I think you're alluding to that even regular lab work may not be the best indicator, right?
Mm-hmm. Correct. And they're going to be looking for other things, like I said, because the symptoms are just more vague.
Mm-hmm.
And more,
with all the cardiologists we've had on this program over the years, I've never gotten this question answered. There are numerous types. We just never asked it. Okay. there are numerous types of stress tests that I've heard of over the years. Okay, it's the treadmill thing. Somebody's telling me about a thallium stress test and some other. Can you enlighten the audience on different types of stress tests and why they do it?
Well, basically, there's just a simple exercise stress test, which isn't using any nuclear imaging. This is usually used on younger patients, just a simple running on the treadmill and doing an EKG and some
no invasive, no drugs, no.
Mm-hmm. Correct. Okay. No imaging.
Okay.
The stress test we use today is usually called a MyoView stress test, where they give an isotope.
Say it again.
A MyoView.
Okay.
It's a radioactive isotope that's given during the stress and resting portion. They do imaging. So before and after you're running on the treadmill, they're doing pictures of your heart, and they can see with this isotope if there's blockages and how well your heart is pumping. And they're also doing an EKG at the same time to see if there's any changes on the EKG with exercise.
Okay, I've probably had 3 or 4 stress tests in my life. And the one that I had a few years ago, 5, 6, I don't know, years ago, was kind of tough to get that pressure or whatever they were reading level up high.
The heart rate.
Heart rate up high enough. And so, hey, I did it. It's no problem. And then I had another one maybe a couple of years ago, year and a half ago. And because of my age, and they tell me that as you age, it's not necessary for you to drive your blood pressure or your heart rate up to the level of a few years ago. So I told them at the end of the test, I said, this was really easy to get to this level. I said, why would you, I'm not debilitated. I can walk, run, and all that sort of thing. And so why would you drop the numbers? And they said, because of your age.
Because of your, and also for some people
and I would have
who are
been
deconditioned
70.
and elderly, or have issues with ambulation, maybe a knee replacement, something like that, they don't even run you on a treadmill. They would simply do a medicated stress test. So the medication that they're giving is going to elevate your heart rate and your blood pressure and mimic the exercise, so you wouldn't have to.
I see.
So it kind of tricks your body into...
Right.
Well, I just thought
reacting
it was kind of strange.
stress.
Okay, I walked in. They didn't have to carry me in.
A younger patient, they really need to work you to get your heart rate up to those levels.
All right. Okay. Second break's here. You listen to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Winter and shop the largest auto mall in Northeast Ohio with one click at KempThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz, there's something for every price range. And KempThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? Never a problem. And we have a huge selection of pre-owns. Kempthorne is a name you know and trust. They've been committed to our community for over 80 years. Shop KempThorne.com.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
Studio Arts and Glass has a special gift for your Valentine. a sterling silver necklace, or maybe a sea glass bracelet and earrings? How about a pewter Hug and Kisses pocket charm? We have pottery and glass dishes that say I love you. We gift wrap and are open Monday through Saturday from 10 to 6 on Apple Grove and 77 in North Canton. Or shop StudioArtsandGlass.com. StudioArtsandGlass.com.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about women's heart health. We've got a lot more to cover this morning, so let's get back to the show.
Before we start back in on talking about heart-healthy options, I want to remind our listeners that the Medicine Center Pharmacies do strive to be your healthy information destination, whether it's our Health Matters radio show or if you need to come in and talk to one of our pharmacists about staying healthy during flu season. It is a good idea to get a flu vaccine if you haven't had one already. There are still time left in the flu season that you could benefit and gives your immune system a good boost. We can also help you get some supplements that can help boost your immune system, whether it be vitamin D or probiotics. Talk to your Medicine Center pharmacist and we can help you. And speaking of flu and strep, with illnesses going around, the Medicine Center pharmacies do now offer point-of-care testing. So you can walk into the pharmacy and not only get your prescription, but we can swab you and test you for strep or test you for flu and then work with your doctor to help you get the treatment and the referral you need. So the Medicine Center pharmacies can help you with those solutions.
Okay. How about a link between menopause and heart disease in women?
That's a good point. Menopause does place women at a higher risk for cardiovascular disease, and that is due to the lower estrogen levels in women. However, the American Heart Association does not recommend estrogen or hormone replacement because there's not shown, they've done studies, there's no increase in the prevention of cardiovascular disease with a hormone replacement. After what happens is after you have a decline in your estrogen, your blood vessels become less flexible. So this puts you at a higher risk for coronary artery disease, cholesterol levels increasing, your blood pressure increasing, and your triglycerides also increase post-menopause.
Interesting dilemma. We can fix that, couldn't we, with medication or not?
Well, the same medications that are out there for everybody, the cholesterol medications, things like that, but not the hormone replacement. And typically, you will see an increase in heart attacks about 10 years after menopause in most women. The typical age will be around 70-ish for women to have this, the increased risk of heart attack and to develop cardiovascular disease. So a good idea is to start the prevention before a woman goes into menopause. So if you start your exercising, you start eating low salt, low fat, low cholesterol diet, you will start that prevention before you ever develop the risk factors.
I keep seeing this stuff on the internet where salt is not an issue. Eat all you want.
I have not seen that. That is
really
not correct.
There's about every goofy thing in the world sold on the internet, and this is a diet of
Don't
some.
believe everything you see.
I know this is a diet of some kind. I'm thinking, come on, man.
We still are recommending the 2-gram.
Why would you post that on the internet? Because
people believe it too.
It's just, I know.
Right. There's a few conditions where you're not supposed to watch your sodium if you have, low sodium or condition where you have a lower blood pressure. But those conditions are not very common, and that would be only upon the recommendation of your physician. But typically, we want you to follow the 2-gram sodium diet, which is no salt added. So not adding sodium to your food, and trying to pick out foods that are lower in sodium, non-processed, non-canned. Stick with fresh vegetables or frozen. Stay away from anything canned or preserved.
I remember as a child, the doctor took the salt away from my grandmother and grandfather. I mean, they had salt on the pepper on the table. They just salted the heck out of everything.
Yeah. Leave it off the table.
I know. So
my favorite is people who salt their salad.
Yeah. my grandmother, she was miserable for, when they took her salt away from her.
You can get used to it.
But, she had heart disease, and there's nothing to treat them back in the
You develop a taste for salt, and you can develop a taste for
anything.
Right.
That's right.
Taste your food again, hold off on the condiments, the ketchup, and the, everything like that. Anything that comes, and I was told once, if it doesn't spoil, it's not good for you. So stick with anything fresh, anything prepackaged, processed, preserved.
Does that mean mustard's okay?
No.
Oh, come on.
Mustard is very high in salt.
Really?
Any condiment, ketchup, mustard.
Jeez,
ketchup's like pure sugar.
Yeah, sure.
Soy sauce. Yeah. Very, very bad.
When you're preparing your food, too, stay away from, the garlic salt, onion, use garlic powder, onion powder when you season
There's
your
a lot
foods.
of varieties of the Mrs. Dash products also. It typically used to be just a one flavor, and now there's a whole line of different seasonings and different flavors that don't have any sodium added to. So you can still have the flavor of your food, and if you add a little bit of citrus flavor, a little bit of lemon or lime, that kind of gives it a salty taste as well.
Okay, interesting.
We had touched on some different populations earlier in the show, and I just wondered if there's any demographic population of women that is at a higher risk for heart disease than maybe I believe that African women are at a higher risk. Is that right?
African American women are definitely at a higher risk for stroke as opposed to white women. They are actually at a higher risk than any other group of ethnicity for women. They tend to, the research has shown that for some reason they have a different way to break down salt. So we all know that salt is, increases your blood pressure, leading to stroke. Why that is, I don't know, but that research has shown that. And they also tend to, for whatever reason, they tend to have higher rates of obesity, diabetes, and again, hypertension, leading to stroke.
What about the European countries like Greece and things? Don't the Greeks have an non-issue with certain...
Well, the Mediterranean diet that the Europeans follow is actually a very healthy diet, and they have a lower incidence.
No, basically, what is it? Vegetables, more fish?
A lot more vegetables, fish, nothing preserved.
Which is be low
fresh,
salt.
A lot of greens, a lot of the oils and the fats that are a little bit healthier. The olive oil and things like that are healthier oils and fats.
Much less fried foods, I believe,
Much
too.
less.
Yeah.
Wasn't that the home of feta cheese or something like that? No?
Correct.
Okay. And
the white cheeses tend to be lower in sodium and also lower in fat. Of course, everything in moderation.
Sure.
Typically better in flavor as well. Your feta cheese, you can flavor something with feta cheese a whole lot more than using a small amount.
Okay. Very interesting. I've read about the Greek diet a little bit, and I've heard a lot of chatter about it here recently, more so than in the past. Yeah. Now, what about dairy products? I heard one of our physician guests a couple of weeks ago said that adults do not need milk to drink milk. Is it bad for adults?
Any dairy product is full of fat, cholesterol.
But 1%
They
milk,
do have skim milk, things like that.
Okay, what are you going to put in your cereal if you don't put milk? You know what I mean? Water?
Skim milk.
Stick
with skim milk.
Yeah.
Even 1% has a much higher fat content and also sodium.
And you get below 1%, and it's water.
You can do it. You can do it.
It really is.
Skim milk and a salt-free diet.
Some would say milk is for baby cows, but,
Okay.
you know. So
You guys are tough. Jeez. All right. I like milk.
Everything in moderation.
Okay.
this is
The
true.
key.
All right. I don't know where we're at, Brad. Go ahead.
All right, how about this? Can heart failure be cured?
Heart failure, can we mention what heart failure is?
Certainly.
First of all, there's a lot of confusion sometimes when somebody says they have heart failure. Sometimes that's misunderstood as cardiovascular disease. Heart failure is a form of cardiovascular disease. Cardiovascular disease is a very broad, generalized topic. Strokes, atrial fibrillation, coronary artery disease, valvular problems, these are all, encompassed under the diagnosis of cardiovascular disease. Heart failure is a very specific problem that is talking about the pumping mechanism or the heart muscle itself. So that the issue there is that the heart is not pumping the way it should be. There are a couple conditions that are curable. Typically, we're just managing symptoms. Medications, diet, exercise, fluid restrictions are all used to manage the symptoms. There are several conditions that fall under the heart failure term that are curable. One would be postpartum or peripartum cardiomyopathy that generally younger women develop during pregnancy or before, during, or after pregnancy. It can be a reversible condition. It does put them at a higher risk later on in life or with future pregnancies for developing heart failure that's not curable. Also, there's a condition, and when we're talking about women, typically seen in women, called Takotsubo cardiomyopathy or broken heart syndrome. A woman who's under severe stress, whether it's illness-related, a death of a spouse, a very traumatic event, will cause this cardiomyopathy, or the heart muscle becomes enlarged and damaged, and that can be reversible as well.
Did we handle some of the causes of heart failure? All of the
some of the causes.
There has to be a ton of them, I would think.
So coronary artery disease.
Sure.
Blockage in the blood vessels, heart attacks. Any condition that's going to affect your heart can affect the pumping mechanism. So an atrial fibrillation, where your heart's pumping very fast and out of control, blood gets backed up and it causes an enlargement.
People are surviving heart attacks much more frequently than we used to years ago. So you're seeing probably a greater incidence of heart failure, right? Because people are surviving their heart attacks.
The heart attack, although your heart doesn't go unscathed, there's some damage that's going to be done, and we'll see heart failure there as well. High blood pressure, infections, drugs and alcohol.
Yeah.
Those all can cause heart failure.
We've recently revised our high blood pressure numbers, haven't we?
Correct.
A little more strict.
120 over 80 are the guidelines. I'm going to keep that blood pressure under tight control.
Kind of running out of things to eat and good stuff. And just keep pushing. Okay, you can't have this. You can't have that.
You just have to be careful.
You got to run 100 miles a day.
Restaurants are doing a better job of, on the menu, putting heart-healthy options or listing some of the ingredients or nutritional facts. Just about every restaurant you can look online. Even if you go to, McDonald's or any fast food, stick with the salad options, or they do have, just if you look and you are aware, it's a lot easier than it used to be to go to a restaurant and be able to figure out what you're allowed to eat, what are the low-salt options, low-fat options.
It's still pretty difficult, I think, to get a lunch in a fast food environment.
It's more expensive.
Right, come and go.
It's much more expensive to eat healthy.
And to have it be a filling lunch, okay.
You don't like salad?
Yeah, I do, very much. Very much, but I how many salads can you eat in a week?
Every day?
A bucket of it each day, come on. No, I love them, but it just, and I don't care if there's a
You
whole
stick
bunch
with
of
the non-fried,
a whole bunch of junk in them, I don't
right.
I don't care.
Chicken sandwich, a grilled chicken. If it's the way in the food's prepared.
Sure.
So if you stick with a grilled chicken sandwich as opposed to the fried,
Sure.
You can still eat out, eat at lunch. Don't go for the fries. Go for the side of fruit slices.
Where are we at on pizza? Because it's bread or bread dough.
Moderation.
Yeah, okay, come on.
Lots of sodium.
Lots of sodium. Lots of
By
fat.
the way, a good friend, Italo Ventura, died a couple days ago.
Yeah, I saw that.
Italo's, yeah.
Facebook.
Oh, my goodness. I think we went to school with that family.
Yeah,
Right.
really sad. I mean, he was always friendly when he went into his shop. And all that
Very
sort of thing,
generous,
so.
too.
Okay, final breaks here. Listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, this is Brad White from the Medicine Center Pharmacy. Do you feel stressed and tired? Do you rely on caffeine, crave salty snacks, have mid-afternoon lows, and can't bounce back? These may be signs of adrenal fatigue. The Medicine Center Pharmacy offers easy saliva cortisol testing and nutritional supplements to help you get your energy back. Talk to your Medicine Center pharmacist and see if cortisol testing is right for you. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
That's right. This is Paul White, and the Half Off on Hot Buy store is your cold weather source. Women's Winter Tech gear boots are only $6.95. Fashion boots are marked down to $9.99. Retail value up to $60. And hats and gloves are on sale, too. New in the store are American greeting cards. 2 for 99 cents. Regular price at $4 each. Also, for snow shovels to floor mats, stop in the Half Off on Hot Buy store. Find the best deals in town.
Hi, this is JP, and I'm here with my grandpa talking about the amazing deals at the Half Off and Hot Buy store in Louisville. Visit our website at halfoffhotbuys.com and check us out on Facebook, too.
Hi, Paul White for the Medicine Center Pharmacy, a locally owned Health Mart pharmacy. Do you know that we partner with Mercy Medical Center to provide low-cost blood screenings in our pharmacies? You can choose from the following screenings: thyroid for $5, lipid profile for $8, total cholesterol for $2, glucose for $2, and A1C for $10. These are the same tests you would receive from your physician. Please give us a call at 330-454-8772 for dates and locations. Come see us at your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Health Mart, caring for you and about you.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Brad, I have been talking this morning about women's heart health with Mercy Heart Center nurses Michelle Amos and Kim Swast, and they know some stuff. So let's get back to the last segment of the show. I would like to put in a little note here. We're currently accepting donations of women's toiletries for Refuge of Hope in our Canton Medicine Center Pharmacy, located at 2526 Tuscarawas Street West, throughout next week. If you would like to donate items, there are many women who are in need and would greatly appreciate it.
How about we talk about diabetes? You know, we, as our healthcare professions morph into serving a lot of different needs than we maybe never thought we would, one of the things we're doing in the pharmacy is having a lot more one-on-one conversations with patients and about their medicines and about their overall health care. And I'm fascinated by the number of people that have diabetes or the diagnosis of diabetes and aren't aware of their risk to their heart. So I wondered if you might just comment on how it's important diabetics be vigilant with their heart health and realize it's really important to take care of themselves, even more so since they have diabetes.
Being a diabetic greatly increases your chance for developing heart disease. Over time, your increased glucose or blood levels of sugar in the blood causes damage to the nerves and the blood vessels and affects your heart. Diabetics tend to develop heart disease at a younger age, and most common, the cause of death for diabetics is stroke and heart attack. The most important factor with diabetics is controlling your blood sugar levels. Good management of your blood sugar levels leads to better control of your heart. Again, the complications of the diabetes are typically stroke and heart attack. Another thing with the diabetics is they call it a silent anginal warning system because of the increased levels of glucose in your blood all the time, leading to nerve damage. Your typical, like we said before, crushing chest pain, your nerves are damaged and dulled. The pain sensation is dulled. So they may be having the heart attack and not realize the symptoms as easily as other women or men or women.
That's true for a lot of
that are not diabetic.
Also,
Interesting.
because of the nerves.
So therefore, delayed treatment, more damage.
Wow, that's very interesting. Many diabetes patients are frustrated with neuropathies in their fingers and toes. I hadn't applied it to a situation like that. That's very
You have nerves
very
throughout your body. So anywhere there's nerves, nerves are being damaged to your kidneys, your stomach. All your organs can be affected by diabetes.
So we're getting close to the 2-minute mark. How about a message to our listeners for heart-healthy things to take with them into the weekend and to start practicing better habits and whatever else you want to make sure that they take away today?
Well, next week we are offering, every year we offer a free community event. It's a heart-healthy cooking demonstration. And it's free, and it's February 13th. It's a Tuesday. It's at our hospital main campus. The doors open at noon. The event includes a presentation by Kate Anderson. She's a dietitian at Mercy. A cooking demonstration by our hospital executive chef. Taste testing, recipes, and giveaway items. So it's free. It's a lot of fun. Please come.
It's a very well-attended event.
It is well-attended. You should probably call in, just RSVP and the numbers.
It is scheduled or not?
It is scheduled. Yeah.
Okay.
13th, and call at 489-1333 to make your reservation.
Okay. What kind of a crowd do we expect?
We get 100 or more people. Yeah.
Are you really?
It's usually
that's
capacity.
in the
Mercy Hall.
Mercy Hall, yeah. Okay.
Yep, and it's Tuesday the 13th.
Okay. Coming up here.
Yep.
Okay.
Given we've been focused on women's heart disease today, too, are there support groups at Mercy to help patients with heart attack survivors or heart disease or things of that nature?
Is there a heart failure group?
We had one at one time. It wasn't very well attended, so we haven't really promoted that too much. Although, speaking with your physician, there's a lot of events out there through the American Heart Association, especially being Heart Month, being February, the big Go Red for women. There's support groups through American Heart Association.
Okay, very good.
So, we're out of time. I guess we could go on a little longer. The cooking program, how long the time is it? An all day?
It's about an hour. It starts at noon. It's in about an hour.
And we dwell on...
We do a little talk. The dietitian will talk. We're going to focus on fats and a low-fat diet.
Okay.
And then the chefs actually prepare a meal right there that you can try.
We're out of here. Thank you very much, Michelle Amos and Kim Swass, both registered nurses. Kim's a heart failure coordinator from Mercy Medical Center, Heart Center. We'd like to remind our listeners, if you suspect you have a medical issue, make sure you contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, Kempthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Join us next week when Dr. Drusilla Grant from Grant Vision Care joins us to talk about optometric vision therapy. Have a healthy week, and we'll see you again next Friday right here on Newstalk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.